Good morning, everybody, and welcome to the New York SBDC's webinar series. I'm Kathy Fitzmaurice from the Central Office, and I'll be your host today for updates on the Affordable Care Act. Your microphones and telephones are currently muted to eliminate background noise during the program. At the end of the presentation, we will have a Q&A session. If you'd like to ask a question, type it into the question box on your control panel, and I'll read the questions out loud. You can submit your questions at any time, but we will not answer them until the end of the presentation. Today's program is being recorded and will be available through WebMQS in the Shared Resources section. I'm pleased to introduce our very own Michelle Catan, Business Advisor from our Binghamton office, and with her is Jocelyn Thornton, an ACA Navigator. Welcome, ladies. Let's go ahead and get started.
Great. Good morning, Kathy. Thank you.
Thank you, Kathy.
Good morning, everyone. We wanted to do an update, the first 6 months of the Affordable Care Act. I had done a presentation earlier outlining a lot of the specifics of the Affordable Care Act and how it relates to individuals, small businesses, larger size businesses. So we're just going to take it from there on and to see what's happened in the marketplace for the Affordable Care Act and finding people coverage as the January deadline had started. So we just wanted to give you an overview of what we've been finding out there. And Jocelyn is our certified navigator here at the SBDC. We're actually in Oneonta. She covers 2 different counties, and we have another one part-time in our Binghamton office. And I know that Albany as well as Jamestown also have navigators as well too. So if there's questions out there, they can help find answers to anything you may have as well too. So just want to give you an outline of what we're going to talk about this morning. We're just going to do an overview of the Affordable Care Act, just a brief outline. We're going to talk about some of the current enrollment numbers that are out there in the marketplace for people finding coverage. We're going to touch on the SHOP, the small business marketplace, and that's out there for our small business owners. And then Jocelyn's going to touch on some tips when people go to enroll in the New York State of Health Marketplace and give you some of the latest updates that we have out there. So first we'll get started with an overview of the Affordable Care Act. It really was enacted into law to help provide affordable health care to all Americans. It required that all citizens obtain health insurance coverage beginning this past January 2014. They do have until the end of the month, this month, March, to enroll in coverage, or they may be subject to a penalty at the end of the year on their tax returns. There are substantial tax credits and cost reductions available in the marketplace to people that choose a coverage through the New York State of Health Marketplace if they qualify, and it's based on income and their house high. The New York State of Health Marketplace, it was established for all New Yorkers to have one place to go to find those qualified health plans out there today. And then there's also the SHOP. It's on the same website. The New York State of Health has both the individual marketplace and we call it the SHOP. That's for small businesses to go to find affordable care, health insurance care for their employees. So that's just a brief overview of what Affordable Care Act really means. We had done a presentation earlier that went into a lot more detail. We assume that most people have a good idea of what it is, so we just wanted to give a quick overview. And if there are any questions, we'll answer those at the end gladly. So now we just want to get into, so what's happened since the Affordable Care Act went into play and people were trying to find their coverage beginning in January. So what's going on with the enrollment numbers in the New York State marketplace and around the U.S.?
Good morning, everyone. This is Jocelyn. So far, the current enrollment nationwide, you're seeing the figures there. The number who have enrolled into private insurance plans versus those who have enrolled in Medicaid. 83% are were eligible for subsidies. So that would include the Medicaid recipients, because Medicaid is, of course, completely publicly subsidized, whereas there were also cost reduction subsidies and tax credits that people could take to reduce their monthly premium cost. Also, at this point, 25% of the total enrollments are considered young adults. In New York State, 908,000 have applied. That means that their applications are in the pipeline. They have not yet selected a plan, or they are waiting for their application to be reviewed and validated by the New York State of Health before they can move forward and finalize their plan selection. Over 590,000 are enrolled. That means that represents the number of New Yorkers who have actually moved all the way through the process and have selected their health insurance plan. Locally, within our center, we have 250 currently enrolled since October 1st, which is a lot. We have probably assisted, our records show, close to 500 people, and that would be both in person as well as by telephone. And we also have some who are awaiting approval at the New York State of Health level so that they can select their plan. So that 250 does not represent those who are in the pipeline and who are very near to plan selection. So we are, we're rather busy here. The current enrollment, you can see by the pie charts, represents that which we discussed on the previous slide, and this does so in a more detailed way. So you can see the enrollment by age. So 45 years to 64 are really the two groups that are the most heavily represented in the enrollment. The gold, of course, 55 to 64, 29%. So that is the largest group that has enrolled based on U.S. Department of Health and Human Services numbers. So these are national figures. These are not state figures on this slide here. And then you can see the financial assistance, which represents the subsidies. So 82%, the last screen said 83, it does hover between 82 and 83% of the number of enrollees who have received some form of subsidy to enroll in a plan.
Okay. The Affordable Care Act open enrollment period ends the end of this month, March 31st. For those that enroll in a plan by the 15th, by tomorrow, their coverage will start April 1st. But those who select a plan after the 15th, their coverage will not start till the following month, which is May 1st. But if individuals don't enroll in a plan by the end of March 31st, they will be open up to a penalty at the end of the year. We've got a slide that outlines what those penalties will be. But they could possibly open themselves up to a penalty year-end if they don't select a plan. The enrollment period for people that are eligible for Medicaid or CHP, which is Child Health Plus for those 18 years and younger, that open enrollment will go all year for them. So they can go on the website, the Marketplace themselves. They can go to a Navigator. Anytime throughout the year, they can go and enroll at any time. The shop, which is the small business marketplace, that as well is open all year round, because a lot of small businesses, they may have their policy, end through any time throughout the year. It doesn't have to be a fiscal year end. So that open enrollment for small businesses as well is open all year round. They can go to the marketplace themselves or go to a Navigator for their free assistance. The other way that people can, excuse me, go through enrollment is if they have a qualified life-changing event. So if they have a child, if they lose their job, if they become married, if they get divorced, those type of life-changing events, then they can go under the Marketplace and apply for health insurance coverage during those events only. Open enrollment ends the end of this month, and then it will open up again starting November 15th, and it will go through February 15th for next year's enrollment for a health plan for 2015. So those are the basic enrollment guidelines that are out there. The penalties at the end of the year. So if people don't enroll and pick a plan by the end of March, and they are without coverage for over 9 consecutive months, for 2014, their penalty is $95 per adult, or half that per child, or 1% of the family income, whichever is greater. So depending on their tax return and what's in their household and what their income is, that $95 may seem small, but in essence it's 1% of the family income. And that is per adult. So if there's 2 adults in the house that don't have coverage and they should have coverage, you know, that's 2 times. And then next year for 2015, it does go up to $325, or 2% of the family income. And then for 2016, it jumps up to $695 per adult, or 2.5 times, 2.5% of the family income. So it does ratchet it up year after year. But for this year, this is the penalty for 2014 if they don't get their coverage by the end of this month. There are some exemptions to this. If you are incarcerated, if for some religious purposes, if you're an Amish, then there are some exemptions out there. But for majority, the penalty will be there. Next, we'll talk a little bit about the shop marketplace, the marketplace that is out there for the small business owners. If a small business owner wants to go into the marketplace or come to see a navigator and look to see what is out there available for them and their employees, there's a few things that they need to make sure that they bring with them. So we just wanted to touch on this again, since we are the Small Business Development Centers and this is who we help. We help those small businesses. They're going to need to know that they've got to bring this information with them. So they've got their, first and foremost, their federal tax ID number. And if they do have, most of them will have that state payroll ID number as well too. When they go onto the marketplace, they're going to have to input all of their employees' personal information. So that's going to include the spelling, the address, their email, their phone number, and the best way to contact them. But the marketplace generally uses email to let the employees know that their employer has selected options for them to choose from. So an email is most important for the employees. So that's going to be for all employees. They should talk to their employees ahead of time to get an idea of what type of products that their employees are looking for. They're looking for family plans, individual plans. Are there specific insurance companies in their area that is prevalent to them that they'd like to go see? So the employer should talk to their employees ahead of time before selecting this to get a good idea of what their employees really are looking for. If there's any questions, talking about doctors eligible, prescriptions, things like that, that the employees want to know ahead of time. They also need to have with them, besides the list of employees, all their average hours as well too. This is something that they will input as they're going into the shop to select a plan to look and see what's out there. And the shop is a lot like the individual marketplace in that the plans that are available are based on county. So depending on what county you live in is what plans are going to be offered for that small business. So you may be in Otsego County or Shenango County, and you're not both going to be offered MVP or CDPHP or Excelis. It all depends on what the county is offering. And in that marketplace, the New York State of Health Marketplace, we'll have that website at the end. There are different resources out there that will tell you which plans are offered by county. So that'll be important for the small business owners to get an idea with their employees what they're looking for as well too. So the shop open enrollment is all year round, so at any time the small business owner can go on and they can look to see what is out there, like I said before, based on their county and their plans. And the small business owner can select different levels of contribution within that marketplace and different levels of coverage. So that means if a small business owner has 2 managers in their office, they can state in there that they want their managers to be, they're going to contribute 100% towards the cost of their premium. And then they can say maybe the clerical staff, they only want to do 50%, and maybe sales staff 25%. So they can put them on different levels. There are different tiers available to individual. There's a gold, a bronze, and a platinum plan that is available out there in the marketplace. And each one has different deductibles, different coverage. And so the small business owner can pick those different levels based on their employees' positions at the shop. So like I said, management can be separated differently. So you would put in, John Smith and Jane Doe. Those are the 2 managers. And then go through and add your 5 salary. And you can decipher the difference in contributions and levels for the employee. So that's a great benefit to the small business owner, and that they can do that. I mean, they have to be the same. So if you have 2 managers, you have to have the same level of contribution. So you can't say one's at 50 and one's at 100. You have to say all managers are 100%, and that you want the platinum level for all of them. So then the employees that are the management level can go on and they can see, okay, so I can pick a platinum plan and go through whatever ones are available within their county, and they look to see which ones they like best and pick it based on that. And the same goes for the next level. If they pick the salary people to be at a 50% contribution level, and they pick all of them to be a silver plan, which is really a base plan out there for anyone. So they can all have a silver plan, and they'll contribute 50%. And then all those salary people can go on and look at those silver plan options for them. There is a tax credit that's available to the small business owner if they contribute at least 50% of the cost of the premiums on behalf of their employees. That tax credit is available for 2014, 15, and 16, and is only available if they get their health insurance through the marketplace. So if they go to an outside insurance broker and get their insurance, they are not eligible for that tax credit. They do have to go through the marketplace and contribute 50% of that premium. But that tax credit is available to the small business owner. And also on the marketplace or through the Navigator, the small business owner can just call up and get quotes based on the county that they live in as to what plans are out there, how much is a platinum going to be for their employees, how much would the gold be, the silver, and the bronze, how much would those plans cost their employees based on, if it's CDPHP or MVP, whatever plans out there with their county, what is it truly going to cost them? Then they can get an idea, okay, well, how much am I willing to contribute towards that as the employer? So that's a great benefit to the employees, knowing that the employer has that option. The tax credits are available to them as well, too. So it really helps them in going through their budget process for the coming year to determine what level they want to be at and giving their employees, affordable health coverage. So that's a little bit about the shop and how it works for the small business owners. It is that one online marketplace that they go to, and they compare the plans, whether they're a gold plan, CDPHP versus MVP versus Excelis. They can compare the plans all within that same gold level and see, how much the deductible is for each one and compare it, how much what the prescriptions are in each one, what doctors are in each plan, and things like that. So you can go through and see all those things within the marketplace to make an informed decision on behalf of your employees. There's lots of options. And then what's going to happen is the employer will get one bill. They'll get one bill, and they can then pass that on to their employees, whether they do it through their payroll deduction. They'll obviously put in their contribution, what levels they signified that they're going to do, and then pass it on to their employees. But there's only one bill that goes to the employer. So hopefully it'll save them time, save them energy, and that they go on once, they pick it all for their employees, and they get the one bill every year, and they can pass it on. So it is a streamline for the small business employer that they don't have to, they have one place to compare everything at their fingertips without having to go to 3 separate sites or ask 3 different people about the different options available. So that's a little bit about the shop. If there are any questions, we'll get that at the end. But I just wanted to give a brief overview of what the shop has out there for the small business owners. Next, Jocelyn's going to touch on some of the tips that are out there in the marketplace that she's learned being a navigator all this, since October and come on board and seeing all the clients that she sees. There's some real good tips that she can give out there if anyone's talking to their clients about healthcare and what they need to do and what they need to bring to the table. So,
the New York State of Health is a web-based enrollment application. This means that various sources are used to verify the applicant's information as well as identity. So for instance, Department of Health, Department of Labor, Internal Revenue Service, Experian, the credit reporting company, these just are a few of the hubs that share information as the navigator, is enrolling the applicant. So many times individuals come in and they have no credit, either due to age or various reasons, and therefore the first component of the online application, the identity proofing, fails because they can't verify their identity through the typical means, which is using Experian. In that instance, I ask to see their identification, and that can mean the government-issued ID, photo identification if they don't drive, or their driver's license. In addition, passport, Social Security card, birth certificates, these kinds of things. I've had people bring marriage certificates and that kind of thing. Also proof of citizenship, because it is asked if the individual is a United States citizen, and if the response is no, then they must provide means that they are legally in this country, and that can mean the naturalization card, driver's license, passport, certificate of United States citizenship, and the like. And once those are inputted, then the New York State of Health will verify that and then clear them to move forward in the application process. And those next steps include household size, because again, the subsidies that these individuals are going to be eligible for are based on household size and income. Those are the two variables. So the proof of income, if they currently are not working, I have them bring in a copy of their unemployment award letter, which states the number of weeks and the amount of monetary assistance that they will be getting from that source. So whatever the income sources are, they need to bring verification of that. If it's IRA distribution, pension, if it is, if they're on disability or, survivor benefits, whatever that is, they need to bring that in. Because it's a very salient point, because therefore the New York State Health has to be able to determine factually what their monthly income will be to derive whatever their eligibility will be in terms of a subsidy. So if they have recently lost a job, they must bring a signed letter from the previous employer stating that they no longer are employed there and the date that they were either terminated or left, whichever that situation is. And for small businesses, for sole proprietors and the like, they need to bring an income and expense statement for a 3-month period. So that can be October, November, December of 2013, January, February, March of 2014. Those things are acceptable. But just to show a window of what their projected income will be for 2014. Because one of the data sources used, of course, is the Internal Revenue Service, and because 2013s have not yet readily been filed by every American, particularly for businesses who also often file extensions, that kind of a current window is necessary for the Department of Health to make a judgment based on what their subsidy might be. So many sole proprietors, I would say that I have probably between 25 and 30% of the enrollees that I have are sole proprietors. The other aspect of it is the access to employer-sponsored health plans. Often I have spouses come to see me whereby their spouse is able to get the health insurance through their job, but it becomes unaffordable for the spouses and the families. So they want to pursue health insurance through the New York State of Health because they believe it will be cheaper and better coverage. And typically that is true. These 10 essential health benefits that you'll see in a few minutes are really the heart and soul of what this Affordable Care Act is. So there were plans prior to this Affordable Care Act coming into play that some offer minimal coverage, some don't offer emergency care or ambulance, some don't offer prescription coverage. And so that's what a lot of the spouses are seeing in their employer-sponsored health insurance for their spouses. So they don't want that. They want to come to the New York State of Health. That is allowable. They can do that. However, if they do that, they have to forego the subsidies that they would otherwise have enjoyed, because the way the law is written is if the employer-sponsored health insurance is affordable to the employee, so it's 9.5% or less of his salary, his pay, then that means that the spouses and the children have to take that health insurance or not take the tax credit or any subsidies in the New York State of Health. So again, they can enroll in the New York State of Health, they just cannot enjoy the subsidies or the tax credits. Household members and insurance information. So another aspect of this application is, again, to show, because Affordable Care Act, the whole premise of it is to make sure that all of the people in the household have insurance coverage. So oftentimes children are already covered under Child Health Plus or what have you. However, I still have to build that household and show every member of that household. So if the husband has health insurance and the child does, but the mom does not, she still has to bring in the pertinent information relative to what insurance policy is covering that other household member who is not pursuing it through the New York State of Health Marketplace. Once a plan is selected, or excuse me, once the eligibility determination is made at the end of the application, again based on income and household size, the applicant can then select a plan. And the plans differ by county, and also some hospitals and institutions take certain insurance. They participate with some insurance companies and others they do not. Then the individual can select a health insurance plan right there. They can look at the benefits, which again are all the same because they're all those 10 essential health benefits. What does differ, though, is obviously the monthly premium cost as well as the deductible. So I review that with the individual. They make a plan selection. And then within about 10 days of them selecting that plan, they'll receive their first bill. Once they pay the bill, they'll receive their cards. That's for qualified health plan selection. However, if someone is deemed eligible for Medicaid, they get 2 cards, the Medicaid benefit card, and that comes under a week, followed by their Medicaid managed care plan, which is Fidelis or Excelis, that kind of thing. Because New York State contracts out with these established insurance companies to handle the management of those cases. So then they get the managed care plan card in about 2 to 3 weeks. So that's how the logistics of the cards goes. And we talked a little bit about the enrollment periods, this first one ending March 31st, and then open enrollment again November 15th to February 15th, except for the life-changing events, births, deaths, adoptions, marriages, that kind of thing.
Divorce, loss of job.
Divorce, loss of job, the big ones, yeah. Considerations when picking a plan. These are the things that I spend really the bulk of the application appointment on with the clients. They're most concerned about how they are going to be able to embed this new cost into their budget. And so we discuss each of the metal levels, look at each of the premium costs for each of those insurance companies as well as the deductibles. There's a maximum out of pocket that's also addressed. And that may be something that a client never has to experience. However, if something happens during the course of that coverage year, cancer, kidney transplant, something totally unforeseen, then the insurance companies require that the covered person participate more monetarily with that treatment. Primary care physician, interestingly, starting January 1st, the primary care physician visit is free, so people like that a lot. Also, the specialists, we discussed that. We discussed what hospitals and facilities and doctors accept for certain insurances and that sort of thing. Again, access of care, right now there is no out-of-network coverage for any of these insurance plans. That may be something that comes in the coming years. That, as well as adult dental and adult vision, there's really no meaningful adult dental or adult vision incorporated in these plans. I understand that in future years that may be offered, however, not really in any meaningful way. The quality of care, the individuals, when they get to this plan selection screen, can actually see the number of stars, which represents the quality rating system, that members gave this particular insurance company. So that also goes into their consideration when selecting a plan. The 10 essential benefits every policy must have. So this is new this year with the Affordable Care Act. So people with existing policies where the President said that they could keep them, that are not Marketplace policies, they don't have to cover by law each of these 10 aspects. So in my opinion, these 10 essential benefits are very powerful for people because they have had plans that don't have prescription. So they buy a whole other plan for prescription drugs. Hospitalization, same thing. Some of these things just don't cover everything outside of the Marketplace options. So this year now, finally, clients can pick between plans knowing that each of the benefits are identical within each plan. It doesn't mean that the copays are identical for each plan. So those kinds of nuances are what we look at during the appointment before they pick a plan. But everything you see on the screen does carry over plan to plan, metal level to metal level.
And the last we'll touch on is there's just a few updates that have been out in the news from President Obama in the Affordable Care Act. So as of March 5th, he announced that the administration will allow people to keep their existing health insurance plans for another 2 years that would have otherwise not have been in compliance with the Affordable Care Act. And that's what Jocelyn just touched on, those plans that don't have the 10 essential benefits to them. So he did say that he would have that extension for 2 years so that they're not out of compliance, and those extensions would be valid for those policies issued up to October 1st of 2016. So if they have those existing plans and they want to keep those plans, they can without having any penalties or any ramifications in having those policies. And today, in the headlines, they talked about the penalties at the end of the year for those individuals that did not have continuous health insurance coverage for 9 consecutive months, that some of those penalties may be waived for certain individuals based on certain circumstances. There's no guidelines per se yet. I haven't had any specific updated information on this, or if there's going to be a specific form that people can use. But what they were stating is that if a family had a foreclosure issue on their home, they were foreclosed on, or if their utilities were shut off at any time of the year for failure to pay, and they were without utilities for a certain amount of time. If they went through any domestic violence situation within their home, or they experienced a death in the family, those 4 life experiences, life situations, could trigger a waiver of that penalty at the end of the year for not continuing their coverage, because based on affordability, they couldn't afford it because of the other factors surrounding their family situation. So that was the latest news that was out there today. Just that basic update that there may be some waivers for the individuals for that $95 or 1% of the family income, that penalty that goes into play at the end of the year when they do file their tax returns. So that was the latest update that we had last night or this morning in the news. And so I just wanted to touch base on what the Navigator, what Jocelyn's position is. Jocelyn was certified through New York State to offer assistance, free assistance with these individuals in trying to find coverage through the marketplace. Their goal really is to provide enrollment assistance to consumers and small businesses when renewing coverage, and to educate and facilitate that enrollment into those qualified health plans offered through the marketplace. And she offers fair and impartial. She does not by any means tell anyone what plans they should pick. She doesn't offer advice. She just helps them in going through the marketplace. A lot of individuals out in our area here, excuse me, out at Seago, Delaware, some of the rural counties, some of them are still on dial-up, and so they can't get to the marketplace themselves. So having the Navigator out there available to them really helps some of these people. They don't have a computer, they go to their library, or they just, you know, can't get through that online system. So the Navigators are here. They're certified through New York State to assist small businesses and those individuals. So here at the SBDC in Binghamton, we do have Jocelyn Thornton. She does at Seago County and Tioga County. And we have Colleen Callahan. She does our Broome County. There's other Navigators within our counties. We just want to let you know what we have here at the SBDC and their email addresses in case you have any questions ever that you might want to ask these Navigators. As I said before, I know Jamestown and Albany also have Navigators as well too within our SBDC family network. And the New York State of Health, this is their toll-free number. Individuals or small businesses can actually call this and go through someone on the telephone and go through the application process if they don't want to sit down with someone. They have hours of operation Monday through Friday and even on Saturday as well too. And at the bottom, the New York State of Health.ny.gov is the online location for the New York State of Health Marketplace. And going on that, you will see it deciphers the individual versus the small business owner. There are resources, information. There's calculators on there to help with people who think they may be eligible for a tax credit. They can put in their family size and their income, and it will give them an idea if they do qualify for a tax subsidy or for Medicaid or anything, any cost reductions. So those are the main topics we wanted to just outline to everyone today to let them know what's been going on with the Affordable Care Act these first 6 months since October when the doors opened up and enrollment started. So, you know, we hope that this was good, informative information for everyone, and we'll gladly see if there's any questions out there.
Thank you, Ms. Michelle. Thank you, Jocelyn. Does anyone have any questions? And nobody's entering any questions. If you do, you can type it into your question pane or press the hand icon and raise your hand.
And I left our contact emails out there in case anyone has a specific question on, you know, one of their small businesses or anyone if they want to talk a one-on-one or anything like that. Our emails are there.
All right. Well, it doesn't look like anybody has any questions right now. So thank you, Michelle, and thank you, Jocelyn. And
Thank you.
Yeah, we hope it was good information for everyone on what's been going out there under the Affordable Care Act for the first 6 months.
all right, well, thank you. And this ends our presentation. And again, this will be available in the shared resources section of MQS. Thank you, everybody, for joining us today. And I hope you enjoy the rest of the day.
Great. Thanks, everyone.
Bye-bye.
Bye.